For ballet dancers, repetition is the key to success. But because dancers often spend up to 6 hours a day rehearsing, they are at particular risk for overuse injury.
There's a kinetic chain that what happens at the ankle affects the knee, and what happens to the knee affects the hip and the pelvis. So if something's going on lower down in the kinetic chain, then if we can strengthen other areas more proximally, that will actually affect that area.
Dr. Carrie Marr, a physiatrist at the University of Alabama at Birmingham, heads up the Performance Medicine Clinic at UAB. She works with dancers on everything from technique to proper conditioning to help prevent injury.
You have to be keyed into the fact that these dancers, the whole idea is it's repetition. And are they doing something wrong? Or is there not enough muscle strength in certain areas of their body, and other areas are having to compensate and then get injured? Very good. So we're looking at 60.
As Marr and her team evaluate
55.
a dancer,
Okay, go back.
they look at the range of motion, how flexible they are, proper positioning and technique. Since the clinic is on site, an injury can be diagnosed and rehabilitation can begin that same day. The challenge is getting to the root of the problem.
What we'll do is try to go that one step further and ask, why is that muscle overused? Are the glutes weak? Are the rotators weak? And if we find that is the reason and we correct that, there's a good chance we may solve the problem and then it won't happen again.
Because dancers often start competing at a young age, Dr. Marr says making sure your child is receiving proper instruction is critical to avoiding injury.
One of the things that people ask me all the time is what makes this setting different from other settings. You know, some of the best athletes in the whole world, they do crazy things just like the normal things that you do with an athletic trainer and a professional sports team, a high collegiate team. The easy answer for rehab might not be the easiest answer for rehabbing people in these shows. I was very passionate about football, and so I knew when I was an undergrad that that's what I wanted to do. That was the only job for me, was being with football and trying to make it to the NFL. A very close friend of mine had a job in Las Vegas working with Cirque du Soleil, and she was telling me how, you know, what her life was like and how it was very similar to what we liked about football. It intrigued me to try it, the idea of working with performers and gymnasts, and I knew what a high level it was. So I came and tried it, and I really liked it. I like it just as much as any experience I have with football. I feel it's very traditional.
The show is about 90 minutes. So we have time, so we have a 90-minute show, then we have an hour between shows, and then we do it all over again for another 90 minutes. We cover certain acts, we do our paperwork like anybody else does, we follow up with doctors, anything that we consider to be our time.
So being primarily in the water, we have a lot more skin issues than what a lot of the other shows have to deal with. If there was a reason for the emergency action plan to have to be initiated, most of the injuries would occur in the water.
We take advantage of this time to really look after some of the things that we need to do, but we still focus on artist safety. It's like covering any other sport.
The very first thing we do when an artist arrives here is they undergo a physical evaluation.
So if they need to go to a doctor's appointment or go have an x-ray or an MRI, we do all this before they begin their training.
And that is to make sure that the job that we're going to ask them to do, that they're going to be safe in doing that so.
After this medical evaluation, we determine if they have any weaknesses or things that they need to have worked on.
We try to use a very diverse background of therapists. So we have therapists that are strong in manual therapy, therapists that are very strong in sports management, therapists that are very strong in strength and conditioning, exercises, acupuncture, because of course we deal with a lot of different cultural background. A very large focus is for us to be able to prevent injuries and to help artists to remain healthy as long as possible, as good as possible. Accidents are accidents and they are unfortunate. It's not a machine, it is a body, so people do end up developing injuries at some point.
They're very understanding and patient people, so they'll work with you. They'll help and they'll take care of it. It's very little stress.
I do a lot of education on how to adapt in a new environment. And also just in terms of staying motivated, to stay motivated to perform 350, 400 shows in a year. But when you're doing a performance for an audience and you see the reaction of people's faces and you give that energy and you get it and you receive it back, I mean, then you could perform 800 times in a year. There's no limit for that.